Top of the morning, Dan and Amy. Health insurance in the time of COVID-19 has been a topic that's come up again and again during the task force briefings over the last several weeks because Trump and Pence have discussed some of the big health insurance providers that are waiving any copays with respect to COVID-19 testing, with respect to COVID-19 treatment for those infected. But there's also been the back and forth between the press corps and both the president and vice president about health insurance coverage for those that are not Medicaid eligible and who otherwise don't have health insurance. Is there a thought to reopening the enrollment period for the exchanges during this time period for those who are uninsured? For more on all things health insurance related in this time, we're pleased to be joined again by our friend C.Steven Tucker. He is the founder and principal broker for HealthInsuranceMentor's.com and a nationally recognized expert in the private health insurance market, to the extent that the private health insurance market will still continue to exist. C.S. Tucker, thanks for joining us. Appreciate it.
Good morning, Dan and Amy.
Let's start with the uninsured. And President Trump, Vice President Pence have essentially said, it's something that we're looking at to make provision for those who are uninsured in this time. Is there anything that has been produced in that vein?
Well, it depends on the type of exchange that the state has. For example, here in Illinois, we have a state-federal partnership exchange. So it is up to the federal government as to whether or not they would open the exchanges outside of the national open enrollment period. We've had about 9 states thus far that have a state-based exchange. So they make their own decisions. If they choose to open the exchanges outside of the annual open enrollment period, that is their decision, and they consult with local health insurers and they make that decision. And several of those states have done that thus far. But we cannot make that decision arbitrarily in Illinois because we do not have a state-based exchange. So it's reliant upon the administration to decide to open the exchanges or not. The reason that they're choosing not to do so is because if they make that decision, 36 states are going to have to open the exchanges in the middle of the year. And that is typically a no-no because, as you know, the ACA, Obamacare, requires health insurers to cover all pre-existing conditions. And so they have to restrict enrollment to a short open enrollment window once a year from November 1st to December 15th, as the state of Ohio and 9 other states did long before Obamacare, in order to ensure that people do not simply wait until they, quote, need health insurance to purchase it. If you do that, human nature dictates people will simply wait till they're sick. They will buy a policy. They will use that policy to cover whatever procedures are coming up in the near future, and then they will cancel that coverage. And that's called system gaming, as our former president used that term over and over again. The reason of having an annual open enrollment period is to control system gaming so you keep premiums low for everyone. And that's the concept behind restricting enrollment.
And so is that then left for those who are uninsured in a state like Illinois? Is that then left to work out with the state and talking about, for example, some sort of expansion of Medicaid to cover those individuals?
Yeah, that's an option. And also, people have to understand the vast majority of people in this country, over 180 million people, have employer-sponsored health insurance.
Right.
And the law already provides a special enrollment period of 60 days where if you lose employer-sponsored coverage, they don't have to open the exchanges outside of the open enrollment period. They are already open all year long for anyone who has lost employer-sponsored coverage. You have 60 days to buy any plan you want. You don't have to have a special rule to open the exchanges. They are already open for you if you've lost employer-sponsored coverage.
When you're talking about employer-sponsored coverage and people who've lost their employer in terms of being laid off and now are in the near term facing the prospect of having to pay for COBRA, and that's considerably more expensive, of course. Is there anything, I know, again, there was initial talk per what was done during the Great Recession a little bit more than a decade ago, government subsidies for people who need to purchase COBRA insurance. Has anything been advanced in that direction to provide subsidies for those who lose their private employer-provided health insurance, can't afford COBRA, and are going to need some help?
Yes. So, again, Everyone who's lost employer-sponsored coverage already has an open enrollment period right now. And if their income is below 400% of the federal poverty level, for an individual that's $51,040, for a married couple that's $67,640, for a family of four that's $103,000 in adjusted gross income. If you make less than that, then you are already eligible for what's called an advanced premium tax credit, or what we call in slang an Obamacare subsidy. And that will dramatically lower the cost of health insurance for all those people under that income level. You just can't be too low on the income scale. If you drop below 138% of the federal poverty level, then you're eligible for Medicaid. And that means that you are reliant upon managed care. In other words, you can't get a PPO plan as you can in the individual marketplace. You are stuck, unfortunately, with managed care HMOs. But either way, the system is set up for people who have lost coverage to buy health insurance right now. They don't need a special order from the federal government. It's already designed to protect those people if they lost coverage right now through an employer.
Okay. This is a question that might be out of your realm, and I don't know if you know about this, but I've heard from two different people who work in the healthcare industry that if a hospital confirms a death, a COVID-19 death, that they get more federal funding. Is there any truth to that? Have you heard anything like that? Because the Cook County inmate who died, he died from a heart attack, but now they're saying it was complications from COVID-19.
Yes, the Medicare reimbursement rates are much higher if you label that demise as COVID-19 related. And so there's an impetus, of course, to inflate the numbers. I'm not saying that's happening, but there is an impetus.
I think it's
to do
happening.
So.
I mean, I know someone who died from cancer who's had, outlived their death date and was in hospice, and then they said post-mortem that they had COVID-19.
Yeah, there is an impetus to do so because the reimbursement is much higher than it is without a COVID-19 diagnosis. So that there is an impetus to do that, and I suspect, due to human nature, that is happening all over the country.
Well, in addition to that, you also have varying reimbursement rates for various treatments, don't you? Because there was some discussion I've seen about the use of ventilators, and some doctors suggesting that ventilators are being overused, where perhaps a sleep apnea machine would be a better better treatment for a particular patient in a particular case. But the reimbursement rates vary based on the equipment that you're using.
That's exactly right. And Medicare, of course, everything goes by Medicare reimbursement rates. And so they put out their reimbursement schedule, and everybody has to follow that. And insurance companies pay dramatically higher than the Medicare reimbursement rate, like Blue Cross Blue Shield of Illinois, for 151% higher than the Medicare reimbursement rate. And so, but everything follows that template. Depending on what the procedure is, there's a reimbursement already predetermined by Medicare for that.
When we're looking at the health insurance market now, you've just described, I think very succinctly, helpfully, the private health insurance market and what the various exigencies create in terms of support or options. Has anything really changed other than some of the big providers providing waiving off copays and for COVID-related testing and treatment? Has anything really changed with the health insurance market pre-COVID-19 outbreak to present?
Well, I will say if you live in a free state, which of course does not include our state, but if you live in Indiana, or you live in Texas, or you live in Florida, or 20 other states led by rational adults, you have wonderful options thanks to President Trump. In our state, for example, you cannot buy health insurance that is not ACA qualified, in other words, not Obamacare, for any longer than a 6-month period of time. So the coverage ends in 6 months. And if you're sick or injured at that point, you can't qualify for other health insurance. So that's why you will not hear me, for example, advertising on the air in the beginning of the year, because you cannot buy a short-term health plan, which, by the way, are a third of the price of Obamacare, 1/3, because they don't cover pre-existing conditions, right? That's the biggest reason. So they keep the costs low. They will cover new conditions or new injuries. But our legislators in Springfield made the decision to limit those to 6 months, making them very dangerous to buy on January 1st, because what good is any plan that ends in June and then you're sick or injured? You won't be able to buy health insurance for 6 more months until the exchange is open again. But in Indiana, they followed the full Trump restoration of short-term plans, and you can buy a short-term policy in Indiana and lock in your premium for 36 months. 3 years, and you get a national PPO network where you can go to our teaching hospitals like University of Chicago and Rush, which you can't do with an ACA qualified individual policy. So there are great options in free states. There are far fewer options here in Illinois.
Very interesting. Yeah, very interesting and noteworthy. Says something about the importance of state and local officials, I suppose. Yeah. He is C.S. Tucker, C.Steven Tucker, founder and principal broker for HealthInsuranceMentor's.com. C.S., thanks as always for your insights. Appreciate it.
Thank you, guys. Take care.
Take care.
Thanks, and he joined us on our turnkey.pro answer line.
This is the morning show more Chicago radio listeners are choosing. This is Chicago's Morning Answer on AM 560. The Answer.
Now that you're spending more time around the house, have you noticed that maybe a few things are needy?
Call Crumweedy.
Crumweedy Home Pros. There's no better investment than your home, and Crumweedy is open, doing proposals and booking jobs. This is a great time to
call Crumweedy.
Right now, no money down, no payments, and no interest for 18 months. Siding, windows, and roofs, all with no money down, no payments, and no interest for 18 months. And there's more. Half-price installation on siding, windows, and roofs.
Hey, Sean Hannity here. Call the exterior experts, Crumweedy, Mark Olson, and Greg Olson of Crumweedy, a third-generation family business that's been doing Chicagoland exteriors now since 1953. It's all about trust, and they truly share your values.
If your home is needy,
call Crumweedy.
630-595-8020. 630-595-8020. Or just remember, homeisneedy.com. Homeisneedy.com. Crumweedy Home Pros.
With your kids doing school from home for the foreseeable future, you've probably never paid more attention to what they're learning or how they're learning than you are right now. And you may be